See how Stryker bends his head and looks around, really doesn't want to bend his neck? Stryker came in and he's gingerly walking around. He yelps in pain when you move his neck. And dogs that have neck pain often will hold their head down and they'll look at you through with the corners of their eyes because they really don't want to turn their neck. Stryker. Oh, but he didn't turn to look at me, he just started walking towards me. So Stryker has a disc problem in his neck, and if you press, usually dogs can have disc problems in their back, and they can have a sore back, and you can sometimes push in the muscles of their back, and they'll sit down, and if it hurts them. Stryker seems to not have too many problems in that area. They can have disc problems up in the chest area or around their ribs, and you can press on the vertebrae there. But Stryker has problems in his spine, and if you press, usually they have pain along their vertebrae, and his happens to be deep. So you can see as I press, he backs away from it, and he shakes. So it's down there. See how he's shaking and quivering? See that? So that's pain in the spine, and nothing makes a dog yelp more. He's already starting to cry. So if you put your hand on your dog's neck like that and gently bring it around, and they start to cry, see, he flinches. He doesn't want you to do that. See, right there, that hurts him. He starts to go down and back. So of course, we don't want to do that. We don't want to hurt Stryker. Huh? Are you a poor baby? He's a poor baby. So what we're going to do, I'm going to show you the x-ray, but what we do for neck problems in dogs is we'll give them cortisone and some painkiller like tramadol. And usually, just like us, back problems and neck problems will go away in a week. But it's always good to have the medication on hand in case it gets worse again. So I'll show you the x-ray, huh, Stryker? Are you a good boy? Are you a good boy? So in the neck, you can, on the x-ray you saw that the vertebrae are blocks like this, and the discs are in spaces between. The discs are like jelly donuts that are holding the vertebrae apart and allowing things to bend like that. When the discs start to collapse, they go upward where the ligament between the vertebrae is thin, and they press on the nerves. So you can imagine that disc is pressing on that nerve, and we bend the neck like that, and that disc presses up on that nerve. Ow, 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 ow. So that's what's happening. And in this, sometimes if the disc collapses and presses upward, it will actually press into the spinal cord and cause the legs not to work, and it may cause paralysis. And that's why a person or a dog, legs don't work very good because the disc can be pressing on the nerve, the spinal cord. If it's just pressing on the nerve, it just causes an owie. If it's pressing on the spinal cord, then it can cause bigger problems. So I hope the model helps you understand what caused the neck to really hurt. And nothing really causes pain like that in a dog. That's the most common cause, a really severe pain, and for them to hold their head down like that and then not to turn and to look out of the corner of their eye. Because they're trying to avoid bending and forcing that disc to press. In here in his neck, and in the neck area of the vertebrae are very hard to read. Here's a disc space, here's a disc space, here's a disc space, here's one, and here's one. This disc looks like it's got some bridging underneath of it. So Stryker's vertebrae are here, and the disc spaces are here. And this is a bony bridge between two vertebrae. When the disc collapses in between the vertebrae, then there's more movement, and the body tries to make a bridge to structurally make it stronger, and that's the evidence that the back is weaker than it should be. And this is gas in the intestines, and the owner does report that Stryker does fart and have a lot of gas, so this is actually a flatus or a fart. Just thought you might want to know that.